Welcome to CareTalk, your periodic home for healthcare business and policy, and usually incisive debate about it.
And now outdoors, brought to you at the JP Healthcare Confab in San Francisco. They're charging so much for rooms out here, we decided to do our first outdoor podcast.
Outdoor CareTalk is good, John. At least
It is,
the weather.
it is, and it's healthy. It's a gorgeous day here in San Francisco, but they really are. I mean, it is a sign of the success of healthcare financially, regardless of whether it's bankrupting the system, that in response, every vendor in San Francisco has upped their prices.
Well, John, I did see a place where there was nobody sitting, and I was going to go in and take a table, and they said it was per hour, $150 an hour, and you told me before you actually saw something a little more extreme than that.
It was extraordinary. A friend of mine with a group of people that bigger than the table he had bargained for went across the street between dinner and lunch at a local Indian restaurant, and he was told he absolutely get the table for $1,000 an hour. So the one good thing about healthcare doing well in America is that it's bringing a lot of wealth to the city of San Francisco.
Just where they need it, right, John? It's going all to the homeless.
Well,
80% of profits to the homeless. So, John,
wish.
What's your general impression of the conference? This used to be really a biotech conference.
Yeah,
Not
no,
biotech
I
guys.
think it's totally changed. What's interesting about the conference is healthcare, now consuming 20% of GDP, which is or not getting up to there. There's growing companies at every level: healthcare services, managed care, digital health, biopharma, as well as traditional pharma. At least based on the way things are looking, it's going to be a robust year for healthcare companies.
John, it's interesting to see some of the companies are doing things that ostensibly could end up cutting costs. So you see Larry Merlo from CVS announcing 1,500 health hubs going to be open in CVS.
Super exciting. It feels like Walgreens and CVS are really, as the plate tectonics move and traditional pharmacies get into, that Walgreens has got some great partnerships with VillageMD. CVS is doubling down and actually tuning into a very different kind of primary care health experience. I think it's really exciting to see traditional companies doing untraditional things in other parts of the sector.
John, we're going to see also, Walmart and Amazon. Obviously, they're kind of afraid of one another. I think Walmart may be afraid of Amazon, but everyone's afraid of Walmart on the retail side. Maybe spurring some real innovations this year. I haven't seen Walmart out here. I'm not sure it hits their price point.
Well, I think the thing about the changing models and the convergence of, let's say, retail and primary care, or Walmart big box stores actually coming and creating small box primary and specialist care access. Amazon, that as those convergences happen, real competition can happen. And I think while the age of the consumer in healthcare was announced a few years ago, you're starting to see it in new product offerings, new service offerings, and in the case of Walmart, significant price discounts. And I think in the case of the partnerships that Walgreens has announced and CVS's health hubs, they're going to be creating new models. They're not going to go with the traditional models of care. And that's actually pretty thrilling. It creates the kind of competition that'll spur innovation. And I think that's how we start to crack the cost and quality problem. It's going to be new models.
John, there's a lot of talk about digital health out here. I saw an article we were reviewing together about how there's confusion over digital health, but at least you see some activities happening there. I haven't actually seen a whole lot about home health and the move to the home, which is something that we talk about. Maybe that'll be 2021.
I think that we want to, at CareCentrix, be leading that. So perhaps it's good that not everybody's talking about it, but actually it is integrated. I mean, Larry Merlo's talked about it at CVS. Bruce Broussard has talked about it at Humana. Walgreens has talked about care back in the community. I think that actually it's like a little bit like digital health. Digital health was seen as something different than normal healthcare. Every healthcare company is going to be a digital health company, David, and I think that more and more of of any of the companies and services that could touch the patient in a central place like a SNF or a nursing home or a long-term care facility or a hospital, if it can be done in the community, that's what patients want, that's what they deserve, and the clinical opportunities to do that are just going to grow over time. And part of that is the convergence of, I think, the digitization of what we do. We're bringing a lot of analytics to bear that are queuing different bundles of services that we can provide in the home. I had a great, really exciting meeting the other day with one of the academic medical centers that's got some very interesting oncology service approaches where we could actually provide more infusions safely in the home in a more infection-free environment, actually. It's really exciting.
John, on the more traditional side, in the sense of traditional for JP Morgan, the biotech companies, there are actually some exciting things happening with some gene therapies and things
Well,
that are going to be
you're paying attention to that because I'm very focused on CareCentrix. So tell me what's going on
I'm
over
just
there.
enjoying myself here, John. I don't know. I enjoy those $1,000 steaks, and they have the hotel rooms that also. What happened to all the beds in the hotel rooms? Everybody's using those meeting rooms.
There are reports of they need so many meeting rooms in the city of San Francisco that they've been trucking beds out to storage facilities from hotels. It's just remarkable.
And again, letting the homeless sleep on some of these
So tell
mattresses.
us a little bit about what's going on in biopharma.
Yeah, well, I mean, you do see that we talk about high prices for drugs, and you're always one to differentiate between the high prices of long-standing things like insulin, Me Too products that should be generic.
It should be dirt cheap. Where, by the way, thank you, Pharma, for jacking up the prices at the beginning of the year by about 5% across the board. That's insane. But there are life-changing, disease-ending drugs where that I think we need to keep the incentives to pay for.
So you see, John, that there's a whole bunch of new gene therapies that are under development right now. It's actually one of the biggest areas in early and mid-stage development. So over the next few years, we may see some actual cures if they work. And then I think the thing will be, you can pay $1 million for those as long as you're not paying $50,000 for insulin.
And I don't know whether you noticed that there was that interesting company EQRx that got announced,
Yes.
where we're starting to see the embedded aspect of analytics and data really potentially remaking the way we think about building and making drugs. I mean, pharma says, and I don't really necessarily believe the number, and certainly I don't believe they're efficient, it takes them a couple of $1 billion to create a new drug. This is a startup that's data and analytics driven that can substantially decrease the cost of a novel drug development, and that's really those are the kinds of incentives we want to keep going. And I think the other thing in biopharma is you are going to see more integration of machine learning, because and I think that is progressing a lot faster than we ever would have guessed.
John, you see, I think perhaps an emerging theme is going to be about how technology working together with people is going to work out. So AI, is big, machine learning, it's going to take everybody's job. But some of the bigger successes, I think, are when you use AI to actually leverage people. One company, that we see out here, Noom, for example, they have coaches that are full-time employees, not a gig economy job, and they work with AI, so they leverage AI, but people are there, and they're not leaving, and they're more successful than somebody who just uses the AI.
I also think the phrase gets us in trouble. I mean, if we think about it as augmentation versus replacement, that's where healthcare is going to leverage the true promise of big data and the true promise of machine learning and the development of new kind of AI-like models. But there's a lot of people who are scared about that. Healthcare is elementally personal. We at CareCentrix believe that putting the patient at the center of care and thinking about sort of the casual inhumanity of healthcare and trying to solve for that is one of the critical elements to sort of unleash the invisible superpower of patient and family and caregiver agency, to give them more control. So I actually think that you're absolutely right, and sometimes that's
a
like
first.
Well, the distinction
between, let it be noted.
Perhaps it won't be repeated, but it's really that it's when the man can leverage the machine that we're going to get the benefit of sort of that broad cluster of digital health.
So, John, sounds like it's been a worthwhile show, despite all the excesses. Are you coming back next year?
Oh, absolutely. This is a great opportunity to actually hear about new ideas, test new concepts, and meet a lot of people who really do care about helping reform healthcare the right way. But I will say that the number of blue suits and expensive hotel rooms kind of worry me. We're still spending too much and getting too little from healthcare, and so the work still needs to be done. So thank you for listening.
Good.
And I hope you enjoy our first outdoor CareTalk.
Great. Well, I'm David Williams from Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
It's been real. Take care.
Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.